With us now to talk about regional efforts to better understand dementia and the impact that it has, we have Deb Richmond, who is Vice President for Education and Outreach with the Alzheimer's Association in Minnesota. And from the Central Minnesota Council on Aging, we have Kathy Gilbride. Deb, Kathy, thanks for joining us.
Thank you.
Let's talk about some ideas first of descriptions of dementia, because people will think of many different things with dementia. So do we have some sort of handy descriptions of what dementia really is? Deb?
Yeah, so dementia by definition is a loss of memory and other intellectual abilities that make it difficult for you to function from day to day. So when you think about everything that you do from the time that you get up and eat breakfast, get dressed, all of those things, a person that has a dementia is going to have challenges every day doing those simple things. Alzheimer's disease is the most common type of dementia, so somewhere between 60 and 80% of people diagnosed with dementia will have Alzheimer's type. But there are many other types as well, things like Lewy body dementia, Parkinson's disease-related dementia, frontotemporal dementias. They all have a little different presentation in terms of symptoms, but most common is Alzheimer's disease. So hopefully that will help differentiate dementia from the different types of dementia.
Yeah, it can cover a wide variety of things. I've even heard of recent cases where people talk about, forms of medication, long hospital stays, and some of the dementia that can come with that, which may sometimes be misdiagnosed or not fully understood.
Yeah, absolutely. So people that have medication interactions can have dementia as a side effect. General anesthetic is one that we're starting to pay a little bit more attention to, particularly with older adults, that they may, if they have a diagnosis going into a surgery, may come out a little bit more severe with their dementia, and it may or may not go back to their baseline. So to be aware of those kinds of things. But yeah, there's a lot of factors that can be included.
Okay. And Kathy, as you look in your work at the Central Minnesota Council on Aging, what are some of the things that you're seeing in the ways that rural areas are dealing with dementia and Alzheimer's and these sorts of situations?
Well, they are banding together and bringing all of their key leaders, stakeholders, businesses, schools, senior centers, all of those types of organizations, and they're following a process that was designed by ACT on Alzheimer's in Minnesota, which is called a dementia-friendly toolkit. And from there, it is a process that leads these groups in the community toward becoming more dementia-friendly. And that means increasing the awareness, getting rid of the stigma of Alzheimer's, as well as education to the community as a whole, to education in community sectors, because the communities are divided into sectors: businesses, hospitals, clinics, schools, residential settings, those types of sectors. And there is education that is targeted for all of those sectors so that the community as a whole can come together and be dementia-friendly.
And isn't that one of the trends that we've seen in the last few years, is with all of the groups that are trying to address issues for dementia, whether it's caregivers or whether it's the patients themselves or the communities that are affected by it, it seems like we're seeing a lot more of cooperation and working together of groups all throughout communities. Is that true?
Yeah, and it really needs to be that way. The effort does have to be at the community level. Any organization, whether it's the Central Minnesota Council on Aging or the Alzheimer's Association, we don't have the capability, just because of sheer numbers of people, to go into these communities and be that driver. So we're providing the technical assistance to help these communities do it themselves and identify that every community in Minnesota, no matter how it's defined, has people living with some type of dementia in it. We're an aging society. We estimate in Minnesota alone 91,000 people living with Alzheimer's disease, and nationally 700,000 people this year will die with Alzheimer's disease. And so this is a problem because of a group of us called baby boomers that's only going to get worse before it gets better. And so communities have to be able to identify this and then identify how to support the caregivers, how to support the people living with the disease with resources that are in a lot of communities available, but they don't know how to get to them. So access can be really difficult. And so ACT was born, if you will, and created this toolkit to really help communities identify what those things are and then help make those connections to people that are living in the communities. It's amazing what's happened in some of these communities. Paynesville is an example of one of 47 communities now, I think it's 47. In Minnesota that have adopted this toolkit and have worked now towards becoming more dementia friendly. And then ACT gave birth to a child called Dementia Friendly America. So now we're seeing this entire movement that was really started here in Minnesota going viral, if you will. And it's really exciting to see people starting to develop an awareness to help eradicate that stigma, because that needs to happen.
And especially, I know when we think of people that we know who've gone through the caregiver's role, that there is often, it seems to me, an isolation that happens with them initially, that they feel overwhelmed because they're often managing, their own children or their jobs or all of the other things. And then you put what is essentially another very large and very difficult job on top of that. So does it take time for a lot of people to sort of break through and realize that they're not alone and realize that there are these community support issues?
You want to start?
Well, yeah, and there's a lot of things that a caregiver goes through emotionally, as well as even identifying themselves as a caregiver. Many of them don't. They just feel that, oh, if my spouse is having signs of dementia, I took the vow through marriage that till death do us part, in sickness and in health, and this is just a sickness or something is different, and so it's my responsibility and mine alone in order to care for my loved one. And we are finding with dementia-friendly communities that they don't have to be alone, and the community doesn't even have to be dementia-friendly. Caregivers need to understand that there are people and there are resources and services out there that can help them. We just need to know that they're there, and they need to tell us.
And statistically, we know that a single caregiver can't do it alone.
Right.
The estimates are that it takes a minimum of 3 people per one person diagnosed with the disease to provide care. It truly takes a village. Mm-hmm. So when you think about these dementia-friendly communities, you're creating that infrastructure to help them be able to do that. Because one caregiver, especially if you're talking in the typical age that might be in their late 70s, early 80s, what physical health issues does that caregiver have that they might be dealing with? And we see financial impact on a national level to the tune of about $9.7 billion annually in added costs to the caregivers, on top of what we know is already the most expensive disease in this country, which is Alzheimer's disease. And so there is that idea of having to educate the caregiver that the support is available, but then making sure that the caregiver is not only able but willing, as Kathy pointed out, to identify themselves as a caregiver and then be willing to ask for that help. It's a hard thing for a caregiver to do.
Right.
It really is.
Well, and I think it also comes along with the stigma of Alzheimer's. If the diagnosis in a family is Alzheimer's, the family kind of stays away. They don't know what to do. They don't know how to act. Very similar to cancer. Many, many years ago, when one was diagnosed with cancer, it was like, oh, is this catchy? We didn't know too much about it, and we wanted to stay away as a family, as well as, that family has cancer, so we don't know exactly how to approach them. And Alzheimer's disease, I think, is kind of similar now. Even though we have a handle on cancer, we may not have such a good handle on Alzheimer's. And so that's why we need to break that barrier of stigma along the way. And when I work with communities, that's what I hear the number one thing is that, it's that stigma. And so we need to, as a whole society, get rid of that stigma.
So we've got getting rid of the stigma, and we've got working as a community and identifying resources, so all of these things. Another question that commonly comes up is, what's the next development in research or care or treatments? Because, of course, people wonder, what's happening there, because great, there are the support systems, but there has been a lot of attention in the recent years, National Institutes of Health, for example, about additional money that's going into this. So are there things that we could be looking forward to there in the future, do you think? And I'll start with you, Deb.
Yeah, the NIH has done a nice job, especially in the last couple of years, with the support of the soon-to-be former presidential administration, of infusing some additional funds for Alzheimer's disease research, which is great. The reality is it's still not enough money. And of all of the conditions there, Alzheimer's is still the most underfunded. It's the most expensive and the most underfunded. So there's still a conversation to be had about more money needing to go in to research. In terms of what we can do looking at the disease at large, we still don't have effective treatment beyond treating symptoms. We don't have a definitive way to prevent, and we don't have a way to cure. That being said, there is a lot of emphasis right now being put on lifestyle modification, diet, exercise, cognitive activity, and social engagement, potentially reducing cognitive decline as we age, which is not dementia. It's cognitive decline that is something that tends to happen as we age anyway. And we get busier, we're trying to get more things done, there's more things happening at a given point in time. If you are caregiving, you maybe are even more at risk just because of the nature of the job of being a caregiver. But we talk about those things as being possible benefits as we get older, but we have not crossed that line yet to say if you do X, you will absolutely be able to prevent dementia. So it's a very careful conversation. But what we do know, for example, diabetes and cardiovascular disease are risk factors for Alzheimer's disease. If you watch your diet and you get more exercise, you lower your risk of those two things, which thereby will lower your risk of developing Alzheimer's disease. Doesn't mean you're not going to get it, but you're modifying a known risk factor. So those are things that we can do, and people need to remember the heart and the brain have a really great relationship. And the more you take care of your heart, the more you take care of your brain, and the more you take care of your brain, there's heart benefit to that. So you have to think about those things as we get older and stay engaged in your community and stay physically active. It doesn't mean you have to join a gym, but stay physically active, eat better. You know, we talk a lot about diets, particularly one called the Mediterranean diet that has been shown to have a lot of benefit. However, it doesn't include meat and it doesn't include dairy. And in the Midwest, that might be tough for some people. But it's a choice. It is an option, and there's quite a bit of research around that diet. But even maybe eating less of those kinds of things, you know, watching your fat intake of those trans fats. You know, instead of going to McDonald's and getting the Big Mac, no offense, maybe you get something different. You know, so thinking about some of those modifications you can make. But we are not at a point yet where I can say with absolute certainty there's a cause and effect relationship to anything.
Sure, but what it sounds like is that if you look at some of the community things, Kathy, that you've talked about supportive communities, having people getting out for walks, having people taking what would seem to be relatively simple things to do that increase general health, and then there seems to be a correlation then between that and reduced Alzheimer's risk. Even if it's not a hard cause and effect link, there seems to be a correlation, correct? And you're seeing that in communities where people are able to get out and walk more and do those kind of creative things?
We are. The socialization, getting engaged in meaningful activities. When I work quite a bit with healthcare providers and physicians, and they're saying exactly what Deb is saying, the diet, the exercise, but also the simple little things. The crossword puzzles are still okay, the Sudokus, you know, those types of things as well.
If you like to do them.
If you like. But
you got to do something that you like, which is also important.
Yeah, getting into activities that will increase your brain activity. That thinking, critical thinking, is good too.
Sure. As we close out this discussion, we've got about a minute and a half left. I'd like to talk about, get back to resources for a minute, because of course, you know, every day there are people who will tune into television or they'll listen to the radio and they'll say, oh, this has happened to someone in my family, what can I do to help? So let's talk just a bit about some of the resources you'd recommend if someone has recently had a diagnosis in their own families. What should they do? And Kathy, I'll start with you first.
Well, of course, I'm always going to say to call your local area agency on aging. And in Swift County and in the western part of Minnesota, it is the Minnesota River Area Agency on Aging. And they have, like people like me who are working with dementia-friendly communities. There's also our senior linkage line, which is a 800 number in a call center in the state of Minnesota. And that links into, again, the Minnesota River Area Agency on Aging. And they have a directory of all different kinds of local resources that people can go to, as well as they have an online service which is called Minnesota Help.info. Oh gosh, Minnesota Help.info.
It takes two of us.
I know. For a village. That's right. Okay.
And Deb?
So with the Alzheimer's Association, we have a 24/7 helpline, which is also a toll-free number. And I know that this station works with several states, and that number is the same in all those states. And I know we'll be providing that later for your viewers. We also have a website that has a lot of resources that are accessible. And we also work closely with the Senior Linkage Line.
Great. Deb, Kathy, thank you both for joining us on Compass. That's it for this week on the topic of Alzheimer's and dementia in rural areas.